Good evening. We have in our midst Dr. Sirish Prayag, Director Critical Care of Prayag Hospital, Pune. We welcome you to the Natco Pharma Specialty Studio this evening, Doctor. We look forward to you talking to us and also sharing your expertise, your advice, the younger doctors of today's generation who are in the space of critical care and those are associated with antibacterial resistance. What are the changes you have foreseen in critical care management?
Good evening. Thank you for this opportunity. Uh, we've seen a lot of changes since the critical care began as a specialty in India in the early 1990s. It's been a 30-year-old journey. And I think one of the major changes has been the uh, improvement in technology and therefore more accuracy of diagnosis and more appropriateness of therapy based on accuracy of diagnosis. For example, if a patient is on a ventilator, the display of graphics tells us more about the detailed pathophysiology of his respiratory tract. Similarly, if a patient is not responding to an antimicrobial, then we have methods of analyzing whether the bugs that have been grown are resistant to the antimicrobials that we are using. So based on these kind of technology, I think we are becoming more and more specific and accurate in treating these patients. Now coming to your question on antimicrobial resistance, yes, that has been a huge problem all across the globe and more so in India. The extensive resistance to gram-negative organisms is one of the biggest problems in Indian ICUs as of now. And this is encompassing all the gram-negatives, but more so in Klebsiella, E. coli, Pseudomonas, and Acinetobacter. These are the four bugs which are showing major problems in terms of its resistance to the current antimicrobials. And therefore, the way to manage them would need to be discussed and would need to be analyzed and would need the attention of all doctors in intensive care.
Right. Doctor, what is your one message you like to give to the young ICU doctors for them to enhance patient care?
Oh, one message to enhance patient care is that be on top of your specialty is in terms of knowledge, accuracy. Don't be afraid of taking the help of other co-specialists. Don't neglect expertise and experience which people have been gathering for last 30, 40 years. There is a trend in the country to say that nothing has happened for last 60, 70 years. Don't fall a prey to that. Make sure that you use the advantage of experience gained by people over the last 60 years.
What is the prevalence of carbapenemase producing bacteria in your practice?
Amongst my gram negatives, almost 70, 80% are carbapenemase resistant, unfortunately, both in terms of Klebsiella and Acinetobacter especially. Not so much of E. coli, but certainly these two are showing significant resistance to carbapenems.
And what treatment options would you look at?
Well, depending upon the enzymes that they secrete, whether it's KPC or NDMs in terms of Klebsiella, obviously we do see a significant number of NDMs more than KPCs, and therefore appropriate antimicrobial needs to be started. And in terms of Acinetobacter, we know that the recommendation is for dual therapy as per the IDSA guidelines of 2023. And therefore, we tend to use appropriate dual antimicrobials for Acinetobacters. These are the two major problems for us in the ICU.
Dr. Prayag, we thank you so much for your valuable time in our studio this evening, and we wish you all the best for your practice and your hospital care.